What do you think about these student loans and the government thinking about stepping in and forgiving them? If you got a big loan, you might think, oh, that's not a bad idea. But you also might think, why in the world you took the loan? Why aren't you paying it back? So can private enterprise, can companies step in and help in this way? In the healthcare industry, where we desperately need more workers, there's a company called Community Health Systems that is doing much more to retain its workers, including trying to alleviate up to $20,000 of their student loan debt. Paul Seegert, a managing partner at PCS Advisors who works in the healthcare industry, joins us on the phone right now. Hey, Paul, how are you this morning?
I'm great. How are you?
We're good. Thank you so much for being with us. This is, enhancing benefits, doing all sorts of things to help retain employees is not novel, but it sounds like the idea of helping pay student loan debt down, helping alleviate that, is a newer way to look at things. Is this groundbreaking what this company is doing?
It is a little bit groundbreaking. I don't know if it's going to address the real problems that are causing staffing shortages. 19% of hospitals are critically understaffed right now, it puts a lot of stress on nurses and other staff. And then you put COVID into the mix, and we've had an incredible burnout rate that was already 40% and has gone as high as some people say 70%. So Community Health Systems has decided to invest more in benefits, including the loan repayment that you mentioned, added tuition reimbursement, paying for certificates and renewals that they weren't completely paying for before. They're trying to get creative so that they can attract nurses to their facilities in a market where there just aren't enough of them.
Yeah, is the biggest issue going on right now is that there are not enough skilled employees, or is it that the pay isn't enough, too many jobs are needed, so you can't get enough good people?
Well, you have a little bit of each of those things impacting the situation, and it's a tough enough job. You have hospitals that are under great pressure to make profits. A large number of them are understaffed. I mean, 19% are critically understaffed. Many more than that are understaffed. And so when you look at the career length for a new nurse, 1 out of 3 won't survive the first 2 years. And it's pretty incredible, the amount of stress that they're under and how that impacts their willingness to stay on the job.
So is that, $20,000 loan forgiveness going to be enough of an incentive?
I don't know that it's going to move the needle in terms of solving the staffing shortage overall, but I think they are certainly going to make their facilities more attractive than other facilities in the communities where they exist.
And I guess, Paul, that's got to be part of the plan, right? Is not just getting the employees, but keeping them there. I'm guessing they're not handing them $20,000 as they walk in the door, but maybe over a certain amount of years, we're going to forgive a certain amount of debt. Is that part of what they're doing, is trying to keep them there longer?
Yeah, exactly right. Exactly right. It's not just come here for a month. Come here and give us some years, and we'll in turn invest back into you.
When we talk just about the healthcare industry, Paul, and that's really where you look, so there's staffing shortages, but you mentioned the last couple of years have been really hard and really stressful. Overall, how are we looking? You mentioned these hospitals have got to try to turn a profit. Are we in a pretty good state right now with the industry, or are these shortages really going to start hampering the quality of care that people can receive?
I think there's trouble. If you look at our ability to train the new nurses that we need, we're turning away 80,000 applicants in a given year that are qualified because we don't have enough capacity to train them. And we're facing we need 1 million nurses in just the next few years. So it's something we need to put more focus on. It already impacts quality of care. Depending upon where you are, that may be more true or less true, but I think there's pretty general agreement it does impact quality today. So it's something we need to invest in, and I think this is hopefully the start of a good conversation and a good trend where we not only invest more, but do what we need to get staffing up to the appropriate levels.
So there's so many shortages in so many industries, just like many of them. We need more people. There's going to need to be more incentives to get kids and adults to change careers and move into this field.
There is, and there's some other things, too, that'll help. There's some automation that's coming, and I think the industry itself kind of pushed it back against automation. It kind of makes sense that sometimes there's fear around automation that it could replace your jobs. But when you're looking at a burnout rate like this, and then you look at some of the very repetitive administrative tasks that we ask doctors, nurses, other skilled professionals to do in the healthcare industry, it can be pretty ridiculous. when they're spending so much time doing data entry and other things that can be automated. So there's also a positive trend there. We have startups and new companies coming in that are automating some of the repetitive tasks that we ask them to do. I think it will be more welcomed by the industry because of this state that it's in, and I think there's positive outcomes that will come from that.
Yeah, speaking of automation, is it just mostly in the office when it comes to the medical field, or are there other things they could be doing, or they shouldn't be doing?
Yeah, there's things that they can do that are even pretty high level. There's examples where they've saved many thousands of labor hours by automating the setting of appointments and some of those administrative functions. But then there's also examples where you have image processing for some brain-saving interventions, as an example. And artificial intelligence can do that at a very quick rate and shorten hospital stays by 3 to 5 days. Save brain tissue because it doesn't have to wait for someone to have the time to sit down and look at the scans and make an assessment. And it's not replacing those professionals, but it's augmenting them and even improving outcomes.
Well, Paul, you talk about, the idea that you worry about replacing jobs, and that's a concern. I think for the patients, there's also a concern of maybe a coldness factor of I'm not dealing with a human being as much. We all know it's a struggle to get appointments and things like that, but I think there's some concern there. Will telehealth become even bigger? Will we do more and more so we don't have to go in, so we don't have to alleviate shortages on being able to get appointments? Doctors can be in different places around the country, medical professionals, and work with people more, or do you not want to see things head more that way?
I do. I think it's a very positive trend, and I think COVID pushed us in that direction a little bit more, and I think that's positive. It even led to some things that we used to do in hospital. There were some cases where they were done in-home, and the outcomes were as good or better. And there wasn't the risk of infection and so on. So I think there's a lot of opportunity for us to do what you're talking about, make care more virtual in many cases, which would drive down cost in the system and can get the same or better outcomes. And that's another whole big conversation is cost. Yeah. We pay so much more than our peer countries, and if we can get automation involved, do more virtual care, we can achieve similar results, maybe even better results at a lower price.
Paul Seegert is a managing partner at PCS Advisors. Thank you so much for being with us this morning, Paul.